Good afternoon, everybody. I'm pleasantly surprised by the size of the crew here. That is a testament to the conference. You might notice I am not DJ Wilson. I look a little different. Although DJ and I share the exact same birthday, not just the same date, same year, whole 9 yards. It's a little creepy. I'm Eric Erling. I'm with LifeWise Health Plan. We, through our family of companies, have had the fortune of being sponsors of State of Reform since its inaugural event and continue to support it across the Pacific Northwest because it is a great gathering, and that's why all of you are here. And I can say, since I'm not DJ, because it would be somewhat self-serving for him to say so, but in watching the video, which was just shot today, obviously, and seeing all of you here right now, I'd just like to take a moment, if we could all give a round of applause to the organizers of State of Reform for a job done. Particularly since they're managing an event in Spokane today as well, thanks to some unkind calendaring. So a really superlative job from them. We are fortunate as a group to have Lynne Saxton with us, the director of the Oregon Health Authority. And first of all, Lynne, thank you for taking the time to join us. A ton of interesting issues going on in healthcare today, and I think your agency is right in the heart of several of them. So what we'll do is give Lynne a few minutes to give some thoughts, some remarks on what's going on in her world. I've got some questions for her to get the conversation going from there, and then we'll open it up to questions from you in the audience. So with that, Lynne.
Great, thank you very much. It's a privilege to be here with you all today. I was doing my homework up in the lobby of the hotel, and attendees kept coming up to me and saying what a great time they had had, what they had learned, and that they were sorry they were missing my remarks, but they had to go on to something else. So I'm really pleased that you made the time. I know it's hard at the end of a long day to hear one more speaker, so I'm honored by your presence. We are very excited at the Oregon Health Authority in the last 8 months to be making significant progress on meeting the goals of healthcare transformation in Oregon and living up to our promise to Oregonians. And as many of you know, we have a large accountability for public health in Oregon, which is the whole state. And we also have a tremendous commitment to the coordinated care model that our coordinated care organizations have stood up that serves our 1.1 million Medicaid clients in the state of Oregon. And I know that all of you in this room are part of what my friend Tim Friedman said in the film we just saw of the communications and team that is building the success in Oregon, and I want to thank you for your engagement and also encourage you to stay engaged. As I frequently remind people, it's time to lean in as we increasingly focus on execution and implementation of the healthcare system transformation. So my goal today is just to touch on a couple key points of what the Oregon Health Authority is focused on right now, and then I'm happy to answer any questions. First of all, as many of you know, we've restructured the agency for performance. When I came, I had 18 direct reports, and we now have 7 divisions with clear accountabilities and responsibilities and an improved management reporting system. So I'm really excited about that. We have most notably consolidated the Medicaid assistance programs and the addictions and mental health program into our health systems division, which will provide a single point of access for the coordinated care organizations. We've been recruiting for the last several months for that position, and I expect to have some good news for you all probably in the next 10 days. I have been really excited by the applicants we have had for the executive positions at the Oregon Health Authority. I was talking to an insurance provider just before this meeting, and he was saying, what do people say when they're applying for positions with the Oregon Health Authority? And it's very exciting because people have realized the successes that you all have produced in Oregon, and there's a lot of genuine enthusiasm about coming here and being part of the ongoing success of health system transformation. Secondly, as many of you know, we're in the process of getting ready for another Medicaid waiver, and as all of you know, the country is getting ready to elect a president. And so the Center for Medicaid and Medicare Services is itself going through a number of changes. We follow their policies closely. We work hard every day to have a very good relationship with them, and we are having talks about how we continue the transformation that has begun in Oregon, but also do it in a financially sustainable way. And of course, we always like to talk to CMS about investing in Oregon and investing in Oregon's success because of our track record for innovation. Thirdly, we're getting ready to implement the one eligibility system in January. It's going to be a sequential implementation. There are a lot of people working 7 days a week, 18 hours a day with Deloitte to get that system in place, but we're very excited about what we see. It's a heavy lift, but the program, the one eligibility system, will really improve all of our work with the clients we serve. And I just want to say right up front, as I said consistently throughout the legislative session, we will not flip the switch and have it be perfect right out of the chute, but it will be significantly improved from where we are today. And then finally, we are continuing to manage the broader portfolio of the Oregon Health Authority, which includes, among other things, in this past year. This is just our past year, or in fact, the last 8 months. But we have accountability for the regulation and oversight of medical marijuana. And as you can imagine, with the legalization of marijuana, that is a huge responsibility with a lot of challenges, but that's a real focal point this year. And then, of course, we've been managing everything from pertussis to meningitis to Ebola. And the management of Ebola protocols in the course of the last year in Oregon. So it's been an exciting year. We have a great team. We're adding 4 new executive members. I think today we have Mark Fairbanks, our new Chief Financial Officer, is in the audience with us. I think you heard him speak this morning. It's been a privilege for me to work with Mark and know Mark for the last 20 years, and we were really glad to recruit him back to Oregon. And we are also recruiting and in the final stages of interviewing a tribal liaison, an external relations director, and a business IT lead. So you'll be meeting some new people at the Oregon Health Authority. And with that, I'll stop and answer questions and discuss anything you'd like to discuss.
Great, thanks, Lynne. So a couple questions before we go to the audience. You mentioned, obviously, the value of healthcare transformation and building on the foundation of some really interesting and successful work that's gone on in Oregon. And also talked about the challenge of finding financial sustainability for that. And so as you look at some of those challenges, I'm curious how you're thinking about those right now. And the big one that comes to mind is decreasing funding over time for Medicaid from the federal government as some of the ACA financial commitments scale down on a percentage basis. At the same time, you've got this desire, obviously, from the provider community to maintain reimbursements, which is the traditional way of whacking the Medicaid budget, is taking it out of that hide. But as you're trying to fund providers engaged in transformation projects, it becomes a really interesting challenge. So give us some idea of how you're looking at these challenges as you're getting your feet wet, so to speak.
That's a great question, and particularly having been a provider, a Medicaid provider for 13 years, I'm very focused on ensuring effective reimbursement and sustainability in that sector as we go forward. We've probably the second week that I was the director of the Oregon Health Authority, I walked into the Capitol one morning in those gorgeous rotating doors. And one of the lobbyists came up to me and said, "You're Lynne Saxton, and your agency is $1 billion underwater." And I said, "Good morning." But it was a good question and a valid point. And so I asked our team, we have some great analysts at the Oregon Health Authority, but we have a woman on our team named Janelle, who I think is here today, who I said, let's do a 6-year projection of Medicaid, because the people of Oregon, the governor, the legislature, all the stakeholders really need to be clear how we go forward in an environment where the federal funding decreases. Former Governor Kitzhaber's $1.9 billion success in getting funding from the government. That ends in this biennium. So we did a 6-year projection of Medicaid going forward, and it's a tool. We built it as a tool so you can change the assumptions in the tool and you can see what happens to the Medicaid spend, and we're happy to use that with any of you or your organizations. I know legislators really like the fact that it's a dynamic process. But bottom line is we learned using very conservative projections that in the 17-19 biennium, the Medicaid pressure on the general fund for the state of Oregon grows to $500 million, $500 million. So what we have done since we did that analysis is we have been looking at all the aspects of the system that we have the ability to influence and ensuring that we are crafting a sustainable model. Now, I don't have all the answers for you today. I had a meeting with a legislator last week who asked me if I'd found the $500 million. And so I don't quite have that done yet. And of course, as everything at the Oregon Health Authority, it will be a team effort. But we will be bringing forward ideas and opportunities. One of the things we did is to get our own house in order as an agency so that we could be effective and efficient and responsive. And having completed that work and having some good analytical tools in place, I think we're ready to have a very thorough conversation with all the stakeholders, the CCOs, the many organizations that we work with, about what are the best ways to operate the system going forward so that providers can be reimbursed successfully, so that CCOs have financially sustainable models. And I think really key to doing that work, and particularly doing it in Oregon, where all of you built a pretty remarkable system, that one of the critical pieces is having the right analytical tools and asking the right questions. So I hope you'll engage with me and be forthright about bringing your questions forward and say, we really need you to think about this. I had a great conversation with a doctor yesterday who he had a very interesting frame of reference. He's an oncologist. And he was talking to me about how we need to view how physicians are compensated in health system transformation. And my way of taking those kinds of suggestions is to convene people to have that conversation in a very thorough way with a strong analytical tool right alongside of me and just say, how do we make those changes? How do we address that? I think we also have some real challenges, which the legislature pointed us in the right direction around rural health. And I think we'll be having some very thorough conversations about the cost structures in rural Oregon as opposed to metropolitan Oregon. So I think we're gonna use strong analytical tools. We're gonna have collaborative conversations that are direct. And then, of course, we put our stake in the ground quite probably decades ago in Oregon in being driven by science and best practice. So we will use that as well to guide us.
Okay. So a two-part follow-up there. You mentioned a couple times CCOs. I'm curious, how do you assess their success to date? I think it fits into that category of remarkable initiatives that have been brought to fruition. But kind of assess where they're at today. And do you see, consistent with that challenge in terms of funding, is greater integration with mental health and addiction treatment, is that one opportunity to potentially achieve savings in costs?
Yes, thank you. The CCOs have done a remarkable job. I'm sure you all know there are 16 CCOs in Oregon. 95% of Oregonians are insured today, and all of you should take great pride in that number. We get calls every single day from other states in the country that say, we want to hear about your CCOs. We want to hear about how you got all those people enrolled in insurance. And particularly what the Oregon model, I think, is showing other people in other states is CCOs can look different, they can have different business models, they can have different system models, but if you set and use a strong set of metrics, you can drive to a common goal. And I think that is one of the key foundational pieces of Oregon's success, is that we were able to identify, not that the metrics were perfect. I've had 4 conversations this week on metrics and which ones are right and which ones are wrong, and I think those are cool conversations. But we set those metrics, and the CCOs drove hard to that, and that has produced a remarkable result. I think going forward, we have more work to do with the CCOs. They have been very candid with me that they relish that work. They're ready to go. They want to talk about things. They are more than direct with me, which I value a great deal. And I think we will see even further progress in the behavioral health space, in the oral health space. I don't know how many of you know about the work the Oregon Community Foundation is doing right now across the state to kind of leverage the work the CCOs and the DCOs are doing in the oral health space so that they address some of the social requirements, social service requirements of getting people to dental care. So yes, there is more progress to be made. However, we have a very good foundation to build on because the CCOs were innovative, they were entrepreneurial, they are entrepreneurial, and they are engaged in the process. They're all leaning in on all fronts, and that's what's going to move the ball down the field. I want to just say another brief point on behavioral health. We have recently built a behavioral health tool, something else that came up during the legislative session, and the tool is now 80% complete. Again, it's a tool that we will make available to whoever wants to use it. It's not yet because it's in construction. But effectively what it does is it enables us to look at behavioral health services across the state of Oregon, across a continuum by age group, starting with 0 and going up to senior citizens, and to look at what services are available to those individuals, what the capacity is on the ground, where those services are offered. Ultimately, we'll be adding an outcomes dimension to that so that we can look at the ROI. And then, of course, we're adding the state spend in each of those areas so that we know what we're doing. That's really critical work because there have been many initiatives in this last year, one led by the Oregon Supreme Court, one led by some of the other departments of justice, to really look at what we can do in Oregon with the crossover between behavioral health issues and incarceration. And so I think we're going to be able to use that tool to have a conversation with the judiciary, with the sheriffs, and with the counties across Oregon about solutions in our future to ensure that we get people with behavioral health needs in the right place at the right time.
If I've been paying attention correctly, I get the impression you're something of a metrics-driven leader.
Yes.
And view that as important. And for my money, a pretty interesting topic came out of the legislative session with Senate Bill 440 and looking at value-based healthcare. And anybody that's spent time in that space, you see that phrase now and your eyes kind of glaze over a little bit because it means umpteen different things to different people. Let alone how you get to some metrics that everybody can agree on. So you've got some taskings, obviously, out of that piece of legislation that obligates your agency to some work on that topic. And I ran across a quote from you I loved. Our desire for data has outpaced our systems. And so as you think about the work you have to do because of that legislation, how do you go about, as an organization, given the requirements, how do you prioritize those, because you can't do all of it at once. It'd be tough enough for anybody with unlimited capacity to come up with agreeable metrics for everybody for value-based healthcare. So how do you prioritize the work, and then how do you show progress on that moving forward?
A couple of things. One, first and foremost, I'm a pragmatist, so I'm very grounded in what can get done, what's realistic, what resources we have to get something done. And so I think specifically with regard to Senate Bill 440, I think we will set up a process with timelines and deliverables and benchmarks so that we're very clear we're getting through the process successfully. I think we also will use some of our skills, which I didn't know the Oregon Health Authority had until I had been there 5 or 6 months. But the Oregon Health Authority has done a remarkable job as an agency that's really about 2 or 3 years old since it was split off from the Department of Human Services, of building this tremendous stakeholder network across the state. We were talking earlier that when I came, I thought, well, the Oregon Health Authority would probably have 100 stakeholders. Well, we have actually about 400 stakeholders. And part of what we're going to be able to do is to use our capacity for accessing different perspectives than our own, which is important to quality, but also structuring that in a way where we can listen, evaluate, use science and best practice to prioritize. That's really critical. And then I think there will be many voices, not just mine, but the Oregon Health Policy Board, which guides us on a regular basis, to say, this is where we need to start. And, you know, frankly, if there's ever an agency that has learned that it is important to focus on key metrics, it is the Oregon Health Authority. And we had that kind of bifurcated experience of standing up this wonderful metric system in partnership with the CCOs, and then we had that software challenge that we had that we just don't want to talk about so much anymore. So we've really learned the value of focus. Years ago in my career, I did a startup with Michael Powell of Powell's Bookstore, and the thing I learned from him relentlessly is focus is critical, and its execution and implementation are impossible without it. So we will focus. And also, it's important to have the conversation in Oregon that we don't have to get everything done in year one. We can get things done sequentially, and I think it's important with our stakeholders to be clear about what that sequence should look like and to be able to have a conversation about that prioritization.
So speaking of focus, one final question for me in terms of your own mental focus. So I've asked you several questions related to some of the nuts and bolts of your work and your agency. As you think about just being a leader in the space of healthcare right now, what are the things or thing you think about in healthcare today?
So the thing I think about the most in healthcare is probably in order is, first of all, I'm very focused on the need to continue innovation in an environment where there will not be as much money as there was for the startup. Innovation is critical. It's critical to our state's commitment to living within that 3.4% growth curve. So that's my number one, is innovation. I have had the privilege in my life of seeing many advances in the behavioral health space and in the physical health space and in the oral health space that are directly related to quality of care, improving dramatically from innovation. So that's number one. Number two is we have 1.1 million Oregonians on Medicaid. That's 25% of the state. So pretty much every day I wake up and I'm very, very focused on those people getting what they need when they need it in a financially sustainable way. It's a huge responsibility to be very conscious, and particularly I'm a fifth generation Oregonian. I take every day that responsibility very, very seriously. Part of what we know about our Medicaid population is they have many, many challenges in their life. And to the extent that we are chaotic or unfocused, it adversely affects them. So that's number two. And number three is Oregon Health Authority has this responsibility for setting expectations for other people. And one of the things that we are strongly committed to as an organization is we can't set really high expectations for others if we don't set high expectations for ourselves. So the leadership team at the Oregon Health Authority is very focused on setting high expectations for the agency across our operations and is very committed to building in those systems, those metrics, those dashboards to ensure that we are performing at the highest level possible.
Okay, so that's enough questions from me. As I've attempted to play DJ Wilson, I think the big difference between us is hair. That's the big variable you can identify. With that, what questions do you have? I think we have a handheld mic. So if you could, when I call on you, please wait for the mic so that everybody can hear your question. So what questions do we have from the audience up front? If you'll wait ever so patiently. We should start throwing the mic. Do we have liability for that? Probably not. Never mind.
It's not healthy. Someone might be hurt.
I'm Mike Huntington, a retired radiation oncologist from Corvallis. And a couple of questions. One is, there's 95% insured, and I know that Intercommunity Health Network is doing the research on what does it really mean to be insured. I have a card, but can I see a doctor? And I want to see as soon as possible the metrics on that. Another question is, I think it's only 4 of the CCOs are 501c3s. The rest are privately held and very opaque to public scrutiny. And Trillium's activities with Centene is the most recent example. Trillium tripling its profits in 2014 and then selling to a Fortune 500 company. We would hate to see that happen. It was very intransparent. I even looked at the records of the Community Advisory Council. No mention of it in 2014. So those are 2 concerns I have now, is that we have a lot more transparency throughout the Oregon Health Authority and within individual CCOs, and also about, does a card mean that I have access to a doctor?
So just a couple observations. You're absolutely right that we will learn about the 95% that are insured and what that means. I think as we go forward, I think the thing that's really exciting and what other states tell me is Oregon is leading other states in is, first of all, again, I want to return to that. We have bent the cost curve more successfully than other states. That's really critical to sustainability. And secondly is we have done a good job with our first round of data, and we can do a better job, and we will, but that data will be the foundation of understanding that population better as time goes by. Secondly, with regard to CCOs and their structures, their various structures, one of the things that we hear from other states is that our arrangement is somewhat unique because the CCOs take different business forms, have different business forms, and what they are envious of us for is that we have been able to achieve so much success with such a diverse portfolio of CCOs. So although we may not be exactly where, your vision of where we should be, what I tend to assess is comparatively, how are we doing with the system we've stood up post-ACA as contrasted and compared to other states. Now, a final point on that is that I do want to talk about transparency. It's a core value of the Oregon Health Authority, and over my Christmas vacation, before I had started the job, I had this opportunity to be at the Oregon coast in the rain with my laptop and do nothing but spend every day going through the Oregon Health Authority website and all the metrics that we have. And yes, it could be improved, and certainly the website could really be improved. It's a little clunky. But I will say that you can go onto our website and learn an amazing amount of the state of healthcare for Oregonians. And let me give you a concrete example. One of the things I pay a lot of attention to is health equity and disparity among services for various populations. So I was very excited to see, for example, that I've used this example many times, so bear with me if you've heard it, but in Southern Oregon, we have a great deal of success getting Hispanic women to their well baby visits and their prenatal visits. The fact that you can go on to a public website in a state that is as small in terms of population as Oregon is, we only have 3.9 million people, and really understand what's happening at the local level is a very solid foundation for progress. So that, again, I'm not saying that we've hit it out of the park across the board. However, I will give great credit to the Oregon Health Authority and the people who preceded me. This is not about me. I haven't been there long enough to have this impact. But they have done a remarkable job out of the chute under pretty complex circumstances of being transparent and holding up information that allows us to build a system of excellence. So.
Other questions? Right there.
This question may be out of scope, and if so, just let us know. It's a question of vision. On one hand, we're covering 1.1 million people. How wonderful. On the other hand, we're covering 1.1 million people. How sad. What's your long-term vision of it? Can we work ourselves to the point where we're covering 500,000, or what's the growth path that really is successful? Covering more, covering less? How do we work our way to a happier state?
Thank you. So first, I just want to be clear, because this was brought to my attention previously that I phrased it out of the right sequence, so I'm going to be careful in my wording here. Our goal is to get everyone on Medicaid who is eligible and to ensure that they have quality care and a good experience. Concurrently, our goal is also to help people who are moving off Medicaid to find insurance and be insured so that the model of healthcare that we have embraced in the state can be effective. One of the things that I talk to our partners a lot about is the importance of kind of Oregon's economic state in terms of our health state. It matters. The two are related. So I think the other point I would make with regard to the 1.1 million people is in the stand-up of the ACA, most states are finding that their data has lots of noise in it. And we think when we go to the one eligibility system in January, the engine of that software is much better at integrating data points without them being identical. So, you know, John Smith and James Smith might be put into the same pool to sort out. So we are hoping that that number will decline. We're not counting on it, we're not banking on it, but we're hoping that that number will decline as the noise and the data decreases with improved technology. So.
Other questions? In the
I
back.
wanna-
And while we're waiting for the mic there, I'd add one observation that kind of jumps out from both of these questions. You know, we've just, in healthcare, gone through a massive time of change, whether you're implementing the ACA or CCOs or whatever it is. And that's tough, complex work. And even when you make great strides, you find things like, hey, I'd like more transparencies on CCO. Okay. I think we're all learning as we go, and it's one of those things where, okay, we figure that out, that's a growing pain, and we'll keep working on it. So I'd just throw that out there as food for thought, that this is complex work to make system-wide change in healthcare. So it's a work in progress, not one fell swoop. What's the next question?
Shall I go? Okay.
Yeah, please.
Hi, I'm David Pollack. I'm a psychiatrist, but I'm also the chair of the state's Healthcare Workforce Committee for the Health Policy Board. And I've got lots of questions I'd like to ask you, but
Let's start with one.
since the presentation you made was including this concept of a behavioral health tool that's 80% done, one of the things that would really help us in our work in terms of the Workforce Committee and the charge that we've gotten from the Health Policy Board to focus in particular on behavioral health primary care integration would be if that tool could include some attention to what the capacity for healthcare workers is in those behavioral health settings, whether it's behavioral health homes or community-based behavioral health specialty programs, as well as primary care homes. Is that something that will be in that?
So yes, on a preliminary basis, it will have some of that, but we're in the process of forming a technical advisory committee for the behavioral health mapping tool. I think we've had about 30 applicants so far. So we're going to really work with the professions to make sure what other things that we don't already have in there we should have in there, and then also to ensure the quality of the data is really first rate. So it's a critical piece, and part of the reason we need to look at the workforce, as you well know, is in different parts of the state, we have to evaluate whether we need waivers for certain requirements for behavioral health workers, because you're not going to get all the criteria met everywhere all the time at the volume that we need to address our concerns.
I appreciate that. There may be some impacts also from, I think, Senate Bill 832 that had some requirements for the health authority to address integrated care and in some of the credentialing and issues, and that might be impacted by that. But it would be nice if someone from our committee might be able to participate in that mapping process.
Yep, I'll make sure that happens. Thank you.
Hey, Lynn, I'm Tom Holt with Cambia Health Solutions. My question relates to public health. As we're kicking off some reform in that area as well. From your vantage point, what are some things you see that we do particularly well in the public health space, and looking forward, what do you see as the best opportunities?
Well, thank you, Tom. Great question. We do lots of things really well in the public health space. And when I met with the managers of the public health division a week ago, one of the things I said to them is my impression in my tenure has been that I don't know how many Oregonians fully understand what the public health division does on a daily basis for Oregonians. And part of what we're going to be doing is making that more clear to people. For example, the way we worked with county public health divisions across the state in terms of the meningitis outbreak at U of O, the pertussis outbreak, some of the protections we had to get in place for the Ebola concerns are just very impressive logistical operations. And I think that is a core competency of the Public Health Division. They do amazing things without much noise and without a lot of drama. And that is something that we have a huge opportunity to build on, and for two reasons. One is that my counterpart in Washington State, who we're hosting here next week to kind of do an exchange of best practice, what's working, et cetera. One of the things she said to me when I first talked to her is she said, "Oh my gosh, I'm so envious because Oregon has public health and Medicaid health in the same space, in the same agency, which means that you have the opportunity to leverage the gains in the public health space in the Medicaid health population." And that's critical because things that are happening in public health that are serious are 10 times as serious in the Medicaid population because of vulnerability and risk factors, et cetera. So one thing we're going to do with public health is they're going through their own modernization effort, looking at foundational strengths throughout the state, identifying where there are gaps, much like the behavioral health system, where are the gaps in critical systems of public health in Oregon, and how do we fill in those gaps? How do we look at funding streams for the public health division that allow it to do best practice work and not just, look for the next source of funding? And truly, this morning we had an exercise that I think it's called the military department of the state, but it was an exercise with the governor for the Cascadia playbook, which is for the how many of you read the New Yorker, for the earthquake. And one of the things I was struck by is we're all sitting in a room, we all have a playbook, we all have roles, we all are doing what we're supposed to do. But one of the things I was struck with is the public health division's role in that event, in that setting, is absolutely critical to the state's ability to recover from something like that and to use those skills they have of going into a very intense, complex, technologically complex and scientifically complex environment and making order of it to the benefit of the public good is a really invaluable skill set. So we're in a modernization process. We're going to look at our foundational strengths and our foundational gaps. We're going to look at how we can leverage outcomes in the Medicaid sector. But we're also going to move forward with, frankly, with pride and transparency around the great work we're doing. A concrete example was in the medical marijuana work that was done in the legislature this year. Part of what we had to do is do a public health assessment of what does it mean when marijuana is legalized, what does that mean for medical marijuana, what does that mean for growing standards, for use of pesticides, all of that. And so it was fascinating to me to watch the Public Health Division really focus on it from a scientific perspective, come up with an action plan, implement the action plan, and I think we can only develop those capacities further to the benefit of Oregonians.
Hi, Christian Foden-Wenzel. I'm with OPB.
Oh my gosh.
You mentioned the $500 million, and you said you're going to talk to some people and come up with some ideas that's missing from the next biennium. Have you got some ideas, some examples, some things, concrete things that we can look at? I know that's difficult, but that's a lot of money, so just a few ideas.
Sure. And first of all, I want to underscore that that tool is a conservative projection. So for example, one of the things that we were told as soon as we kind of unveiled it was the fact that it may be too conservative. For example, we did not put into the tool any assumptions around drawing down the growth in the general fund that occurs on a biennial basis, which is about 5% per year. So we didn't include that. But in those dollars, one of the things that may occur is in the areas where Oregon is leading the country in innovation, we have an additional opportunity to draw down federal investment to advance change. So going back to my focus on innovation as job one, I'm very excited. I have raised a lot of money in my life for charitable purposes, and one of the things I'm very excited about doing is going to the federal government and saying, look, we're doing this amazing work in Oregon, and you need to double down on your investment if you expect to build models of success around the country. The second is to really look at what's left in the system in functioning, including the integration of behavioral health, the integration of oral health, to identify additional efficiencies. Most people I talk to around the state who are involved with healthcare don't think we're getting it all done perfectly yet, that there are opportunities for further efficiencies and increased effectiveness in the integration of healthcare. So that would be a second thing that could drive down that cost, that spend, to tighten it up. The third that I would just give you is the notion, this whole notion that after you have a startup, you have kind of a truing up process. I mean, we were running hard and doing a lot of things for several years here in Oregon. And so my expectation is that the numbers that we're using, both our forecasted numbers and our eligibility numbers, could improve, and that could reduce the pressure on the general fund as well. And there are others, but those would be my first three, and we'll continue to keep sharp focus on those opportunities.
I'd like to give Lynne credit for the understatement of the day that she was talking about the response of various stakeholders in the healthcare system. I think you summarized it as they don't think we're doing it perfectly yet. And I think if any of us have gone out and talked to other stakeholders in the healthcare system, that's a pretty standard response. They don't think we're doing it perfectly yet. But I thought that was a good answer to a tough challenge. I'm glad you asked that question. Speaking of questions, final call for questions before we conclude. And I saw one more back there. We'll get to that one too.
You bring up stakeholders again, and I was wondering, I understand that hospital associations and providers and insurance companies, the patients coming from working families, are they stakeholders, and who represents them to you?
So yes, they are stakeholders, and many people represent them to us, and tomorrow I'll know exactly how many. So when as I mentioned, when I came to the health authority, I kind of expected there would be a certain number of groups that were very focused on healthcare. And I underestimated it significantly. So we have, tomorrow we're actually setting up a stakeholder process because I think we can advance change even faster if we have a more sophisticated and use all the technology that we have available to us communications effort. So we have you know, in the course of any week in this job, I will talk to actual members who have a challenge with their benefits or with their services. I will talk to at least probably 5 to 10 organizations representing the interests of discrete member communities in the Medicaid population. We have a process in the agency where we set up advisory committees to ensure that we're hearing from people about what's working and what's not working. And I applaud the Oregon Health Authority for getting that infrastructure in place. I think we can significantly improve our performance by structuring it a bit and using technology more successfully that will facilitate us being more responsive. So yes, we do hear from members regularly and their representatives. We have lots of community organizations in Oregon that were very instrumental in the system being stood up, particularly when the enrollment eligibility system was so challenging, and they deserve recognition for their efforts on behalf of our members as well.
Final question.
Hi, my name is Brian Schneider. I'm with Valley Insurance Professionals out of Salem. And in light of what you just said, we have been working with the Oregon Health Authority since the Oregon Healthy Kids program started a number of years ago. We were excited to be one of the few agencies that embraced that. We recognize that there's a kind of a divide in the agent community. There's about 12,000 resident licensed health insurance agents in Oregon, and there were only about 1,000 agents that took part of Cover Oregon when it was going. Our agency represented quite a substantial portion of the enrollments that were done both on qualified health plans and on the Oregon Health Plan. And we want to know from the agencies and the producers that are wanting to engage this new market and wanting to engage this conversation with people who need help, which is the core of what we do. Our mission is to empower and educate people to make the right decisions and understand what their options are, and that's what we're doing. How can we collaborate with OHA as an agency, as an industry, with other agents who might be like-minded to better reach the populations that we already have access to, that we're already talking to on a day-to-day basis?
Mm-hmm. So the quick, simple answer is please give me your card, and we'll, you know, but I also have some further thoughts around part of what our Chief Health Systems Officer will be doing when they arrive, because one of our challenges is, to the earlier question, is when people move off Medicaid, getting them insured, encouraging them to be insured, helping them think through what are their resources, what are their points of access, what are their considerations, so they don't go on to Medicaid, go off Medicaid, and then don't, you know, they're uninsured again. That's not the goal. That's not what will make this system flourish. So please give me your card, and then it's already on my to-do list as a policy area we need to address and focus on, but I can't give you a clear plan today, but it's on the list, so that's critical. So thank you.
Okay, well, there's clearly been a lot of interest, as testament by the number of attendees we have, the number of questions. I even had a couple almost off-topic questions that came to mind. One of your riffs was talking about pesticides and marijuana. I'm like, oh, there's this whole round of questioning we could go down with organic marijuana.
Indeed.
Let's not right now. There was a question about what Cascadia project, earthquake. Do you do planning for the zombie apocalypse as well? We'll spare that one as well. Instead, if you would join me in giving Lynne and the organizers of State of Reform a round of applause.
Thank you all. Thank you.